Hi, my name is Kiera Valentino. I'm in the RN to BSN program at Midwestern State University, and today I will be talking about my Capstone project. The title of my project is Improved Patient Care with Utilization of Bedside Shift Report. So the objectives of this presentation will give the audience a identification of the need for bedside shift report, as well as being able to understand how bedside shift report or appropriate bedside shift report affects patient outcomes. We will also discuss the benefits and challenges of bedside shift report, as well as how the Joint Commission recognizes how bedside shift report should be and is a standard practice for patient safety. So bedside shift report, it's a professional exchange of patient information between two healthcare providers. So in this case, it would be between two nurses giving handoff at shift change. Appropriate or effective bedside shift report will always take place at the patient's bedside. This does not include the exchange of patient information at the nurse's station or out in the hallway. It is directly at the patient's bedside. This promotes both patient and family involvement of care, which both increases patient safety as well as satisfaction. So the rationale and purpose of bedside shift report ultimately is to create a culture of safety. Many studies have found that ineffective communication leads to increased errors in patients. And this strictly comes from not utilizing bedside shift report the way that we're supposed to be. In fact, one study found that 70% of adverse events are due to miscommunication. Another study, which I'll explain later, found that 80% of errors were due to miscommunication from not giving handoff at the bedside. So that kind of shows how important it is to ensure that we are using bedside shift report effectively. Even the Joint Commission found that the need for bedside shift report was very much needed. And it was actually a safety hazard when we weren't using it. So they did actually make that a national patient safety goal. And again, just ineffective communication overall leads to more errors, not collaborating with our colleagues the way that we should be, not passing on patient information appropriately can lead to increased errors. So significance of bedside shift report, kind of going off of what I had said earlier, it leads to errors, miscommunication, decreased collaboration, decreased patient satisfaction. When we appropriately utilize bedside shift report, which again is done at the patient's bedside with patient family involvement as well as visual assessment from both nurses, it increases our attention to details. So specific to my proposal, we're talking about patients in critical care units or acute care settings. Because the level of complexity that they have is so high, they require more attention to detail. They are on more drips, they're on ventilators, they're trached. They just have a lot more complications that require an effective communication between two nurses. So for this proposal, my PICOT statement is in acute care settings. How does the implementation of bedside shift report compared to non-patient involved shift report affect quality of care as reported by Press Ganey satisfaction survey scores? So the healthcare organization that I work for identifies patient experience and satisfaction based on Press Ganey scores. A lot of our patient experiences and overall satisfaction really does come from the utilization of bedside shift report, just because it allows them to actually feel involved in their care. We're not leaving them out of the blue. We're not making them feel like they're not involved in their care, because they are an important aspect and they are an important team member in their own care team. So some literature reviews I found. Most of the literature that I have found regarding bedside shift report does show that when we use it effectively, the amount of errors that occur come down. Patients are more satisfied. Even though we don't want them to come back to a critical care unit, they are more satisfied coming back to that same hospital organization because they know that their staff is going to treat them as a member of their care. Kind of like I said earlier, one study did actually find that 80% of medical errors were due to miscommunication during handoff. A lot of this comes from not being able to visually see the patient. When we're giving handoffs, things are missed, things aren't spoken upon, and that really increases the risk for error. For example, I am an ICU nurse, and I have had instances where we didn't use bedside shift report because the offgoing nurse or the nurse who was giving me report was stuck with another critical patient, and she just didn't have the time. That unfortunately did lead to me not fully knowing the whole story of what was going on with my patient, and she was on a heparin drip that she did not tell me about. And those are important aspects that do need to be shared between nurses and handoff. You know, the type of drips that they're on. Are they on a ventilator? Are they verbal? Do they have certain comorbidities that really affect their care? So those are things that can really be visualized and talked about during bedside handoff. Most of the other literature as well has stated that when we do bedside shift report, there is a higher quality of care. As nurses, we feel more connected to our patients. We feel more comfortable with their care when we can go in with the other nurse, look at everything, discuss anything that had happened, and then go ahead and decide a plan of care at that time. However, unfortunately, bedside shift report does remain a hesitant practice to this day. We'll get into a little bit more of that later. A lot of it is due to kind of in the example, maybe nurses are dealing with another critical patient and they just don't have the time to go over an effective handoff, or maybe they just don't like the fact that it takes longer than if you were to step out in the hall and be like, all right, here's what happened. So those are a few of the hesitancies that nurses can experience that can lead to not effectively using bedside shift report. Some other ones, like I stated earlier, the Joint Commission even got into getting nurses to realize that bedside shift report's important. That's something that, as a nurse, our duty is that we need to follow our standard practices, and that's one of them. They made bedside shift report a national patient safety goal because they recognize the difference and improvement in our patients when we effectively utilize it. So it is a standard practice that we should be following. Unfortunately, not all nurses do. So that's something that we all really need to work on as nurses, as healthcare organizations, is that this is what we're utilizing. So, the simplest thing is that when we do effective communication, we can prevent errors, even life-threatening errors. Going back to my previous story, my patient was on a heparin drip and I had no idea. And that's a medication that requires lab monitoring and physical, patient monitoring. And so, my patient could have experienced a life-threatening complication if I would not have caught that immediately. The other thing, when we utilize bedside shift report is that we're building relationships with our patients. Our patients feel a lot more comfortable to be honest with us. They feel a lot more comfortable to ask questions and to even maybe ask questions about, do you think that's right? Or maybe I have some other input that I would like to give. So it really allows them to feel like they can trust us as their healthcare providers, which is ultimately what we always want. So now that we know that bedside shift report is important and that we need to be utilizing it, as I stated earlier, we're still hesitant. Nurses are still so hesitant to use this practice. One of the things that I found in our literature reviews is that nurses are so hesitant to utilize bedside shift report because they're not comfortable and they don't know what to talk about. So many people discussed creating a formal report, something that we utilize at every shift change. These are the things that we cover. These are the things that are most important. So we're not wasting time. We're not feeling lost, and we focus on the most important things that our patient needs. So for this proposal, plan, this is what we start with. We know that there needs to be a change. We know that we need to increase the use of our bedside shift report, but we need to identify, why is it not happening? We know we need a change, but why isn't it happening? So after we identify that a change is in fact needed to our specific unit, in this case, it would be our ICU, a 16-bed ICU. We need to develop appropriate interventions that we know are going to improve our patient outcomes. So this would be specific to our bedside shift report. So what do we need to include into our bedside shift report that we know is going to improve the outcomes of our patients? Knowing this, we would develop a team, a multidisciplinary team. So this team would involve the nurses, it would involve a clinical educator, it would involve a nurse leader, and it would involve somebody to physically watch and audit bedside shift reports. And this is where our mandatory bedside shift report rounding comes into play. One of our auditors would be going around every morning as well as every night during shift change and watch the process take place. And they would audit that process so that we know we can identify the areas for improvement. We can identify what was great. We can identify how the patient seemed to be reacting to it. So that is the overall plan before we evaluate how that worked out. So implementation, we need to identify who's our greatest stakeholder. So obviously in this case, our greatest stakeholder is going to be our patient. But not only that, it's going to be their families. It's going to be the nursing staff, our educators, our leaders, as well as the healthcare organization as a whole, because we know that bedside shift report or ineffective bedside shift report can lead to decreased patient outcomes. It can lead to errors, and that's a big effect on our hospital system. So we also need to recognize that they are a stakeholder too. We've discussed that we're going to develop a multidisciplinary team. With that, what we want to do is perform a gap analysis. So a gap analysis is going to help us make a comparison of appropriate bedside shift report given from our literature versus what our current practice is. So what is our current unit doing to provide handoff to nurses? After that, coming back from what I had said earlier, based on what we know our unit needs or what our patients on our unit needs, we're going to create a formal bedside handoff. We're going to create a report sheet that is pertinent to our unit, that is pertinent to our patients. So for example, a lot of my patient population is ENT patients and transplant patients and liver patients. So knowing all that information, we're going to ask nurses, what do you think our most pertinent information is, and what do we need to be able to cover during bedside handoff so that we're not wasting time, we're hitting all of our marks, and we know that we're getting the most information that we can. After that, we're going to evaluate how is our process working. So we're going to do that by doing three things. We're going to do the bedside audit, like I had discussed. We're also going to do post-implementation surveys for our nurses, and we're going to utilize the Press Ganey satisfaction surveys. So just as important as it is to get patient evaluation or patient feedback, we also want to know the feedback from our nurses. We want to know, how did you like this implementation? What do you think needs to be improved upon? What's your input? What do you have to add to this process to make it better, that you think is going to make it better for our unit as well as for our patients? So that bedside shift report audit, to go a little bit more over it, it would really target what was improved during bedside shift report, and this is going to be over the course of a 4-week period, as well as what do we need to improve upon. So what do you think is going to be better for our patients? So we need to know, who's this going to affect? Who are we going to go to for this? So professional nursing organizations, of course, should be involved in this. So specific to this proposal plan, the American Association of Critical Care Nursing, this would be something to present to them because they do also reflect how bedside shift report treats critical care patients. Unit-based councils for different units can also be included because while this proposal is talking about this with critical care patients. It's needed for all nursing departments. It's needed for all patients. So this can be presented throughout the hospital to unit-based councils, which is a committee of nurses basically, as well as education committees, and then of course your nursing staff during meetings, during monthly staff mandatory meetings. This needs to be presented so that it can be discussed and improved upon. So concluding all of this information, Bedside Shift Report overall is going to reduce your harm and increase patient satisfaction. We also know it's going to build trusting relationships between the nurse and the patient, and it's overall going to create a culture of safety, which is what we want for our patients. We want that for our families. We want them to feel comfortable being where they are in such a critical time in their lives. And just by utilizing Bedside Shift Report, we easily can make that done. So that is my capstone proposal. I hope y'all enjoyed it and y'all have a great day.